Hello, everybody. And as already Marianne said, that I'm orthodontist, and at the same time I am osteopath, and my approach is interdisciplinary for my patients. So, and the goal of any orthodontic treatments, improving approaches to treatment of malocclusion through the identification and elimination of iatrogenic effect and the development of the algorithm application of the treatment. And the most important task of the orthodontist to get long stability result and aesthetic result. Why we have a malocclusion? So why after orthodontic treatment, time to time we have a TMJ disorders and any general problems like headache, neck ache, and other. Why so many relapses after orthodontic treatment? A lot of patients have already had the orthodontic treatment, and few years later they start again. And many years ago, I read one book and said that planes connecting symmetrical skeletal part in the healthy human body.
So, anyways, I'm so fucking glad it's over. You don't even know.
I'm sorry.
That is a fucking relief. And now I got to go watch Blanche's daughter. Not watch her per se, but hang out and take her to dinner. That's the only thing.
Anita, please close.
She loves to go out to eat. And she eats one meal a day. 42. Yeah, man. It is, you know, you have a handicapped kid, it's unbearable. It's unbearable. Yeah. So Blanche is managing, you know.
I'm sorry.
Anyway, so
can you switch off the
I know, and
volume?
Well, I sent the press release to Blanche, and I had Blanche send it to Chingling.
Okay, can I?
She's just such a sourpuss. What is up with that?
I don't know. She was.
Marian, you can do it by yourself.
Really nice to me. I don't know. She's.
Wow.
Sometimes I know it's really weird. Like, she called me yesterday. You know, this is the bald stuff. Please don't share. I know you won't, but
you can switch off by yourself.
What are your thoughts on this Grant Cardone thing? She's like, I don't see how it really applies to anything that we're doing.
I don't either.
Okay, can I say? Yes? Yeah,
it's
thank
okay. Please continue. Sorry.
So, and this phrase turned upside down my life. And first of all, let's have a look 160 years ago. Already at that time, Dr. Wierald was talking that understanding the relationship of functional process and the body prompt us to pay special attention to the feet as an organ of proprioception. Today, dental veil in musculoskeletal disorders of ascending and descending etiology affect almost the interpopulation of the goal. In spite of this, there are few developments and treatments in the scientific literature that are reasonably applied to clinical practice for the elimination or correction of malocclusion and postural muscular balance disorders. Because all our muscles are connected to each other as an anatomical train, like tensegrity system. The equivalent of the term of myofascial meridian. We made our theory based on the anatomical train. So if the planes are not parallel or not perpendicular, then the human body is unbalanced. So let's do the simple test. Marian, you will try either to do the simple test. Turn your head to the right and to the left, please. Like this and this. Please do it. I can see you. So please do it. Okay. So what's the difference? Who has felt the difference? Now, tight your teeth and try again to turn your head to the right, and to the left again. And now you can tell me, is it easier or worse? So in this case, we can realize that then if it is with the bite, with the tight teeth, so it means the bite is the main area of the compensation for dysfunction of posture. And it is not the dentist, for the dentist who should start working. But for example, an osteopath or chiropractic or kinesiotherapist, if it is heavier to do this, so then the bite significantly affects postural dysfunction. And we, as a dentist, we should start work first. And of course, to involve our colleagues as osteopaths and others. As a result, we can see the correlation between bite and whole body. Impairment to vision, hearing disturbance, malocclusion and tone displacement, TMJ overload, hyoid bone displacement, compensatory displacement of the head anteriorly or laterally, thoracic hyperkyphosis, breathing disorders, lumbar and cervical compensatory hyperlordosis, pelvic distortion, and of course, the feet disorders like a pes planus. Let me show you the small case. This is effect of TMJ and feet with the osteopathic support. This is a lady before treatment. She had a skeletal class 2 malocclusion, protrusion of the upper incisors, low tongue position, as you see, and hyoid rotation. This is after treatment. Increase the skeletal class 2 malocclusion, position of the tongue, profile, deep bite, and protrusion. So this is her result before and after 14 months treatment, and we can see how we correct the curve of SPE. If you see so deep the curve of SPE, it's mean that the swallowing is totally unbalanced. It's a horrible swallowing because in this case, the tongue goes to the buccal teeth and make the deep of curve SPE. And here we can see the remodeling of the TMJ condylus. Marian, can we see the correct, the full picture, or I can make it less? Like this. Is it better? Marian?
It's better, it's okay.
Are open for the all, or is better? Okay. Oh, wait a second. So And if we check the myotronics, yeah, like this, sorry. We can see before treatment, the temporal muscles as preventional load in the test of easy closing and maximum compression of the teeth. And after treatment, in the test of the light close, the load of the masseter prevails, which indicates positive trend. With maximum close, there is some discoordination in the work of the temporal muscles and masseters, which requires osteopathic correction. And before and after treatment, what we can see, her shoulders are raped inwards. This is a violation not only of posture, but also of metabolism. Since there is a lymphatic duct under the clavicula, which collect the lymph from the whole body, right from the head and right hand, and left other things. So, and we can check her feet. So before treatment is pseudo hollow feet and pes planus, and after orthodontic treatment with brackets, improvement of the lateral longitudinal set of the feet is very important for the correct pattern of the step. So in the head is much better. And body always adapts to put the head in correct position relative to true horizontal. And you can see what is changing in your case. And what is my very important questions? What is the first reason for posture disorders? Antoine de Saint-Exupéry said they all grown up were once children. And everything depends on our life. For example, the thumb sucking, what is the difference when the baby use one finger or three fingers? This is very important questions. And our baby show us a lot of information. Like one finger means to relax the palatal suture with the under compression after the childbirth. And this is an important component for nasal breathing and the development of the sinus and facial skull as a whole. Three fingers, it's a calm of tremor of the tongue. And this is activate the vagus. And the reason is due to the immature nervous system and goes away by 1 month. And if not, so then this baby can have a dysphagia and development inhibition is general, etc., etc. It is really bad dysfunction with the pyramidal system. So, and a look and this office plankton. I call it office plankton because he has a compression of the blood vessels, veins flying, and so it's a high impedance, it's decreased blood flow through the brain, increased blood pressure, and impair vision, and decrease the performance. So how can he be a very good worker? Bad habit compensation to pelvis torsion. So, and it's very important to check a one-hand playing on a music instrument. It makes our posture horrible and problem with the bite and problem with the whole posture, with everything. So we have to check one side position of the sport, especially the homolateral sport. It's it's make worse all our orthodontic treatment and another dental treatment. So the reason for relapses of orthodontic treatment is the structure, biochemistry, and mental disorders. It's very important to check anamnesis as sport, music, how many traumas, when it happened, and what else with the main problem, hormones, metabolism, with the internal organs, with mental disorders. So everything. Everything can be reason for relapse for orthodontic treatment. So, and we have our discovery and about structural effect of orthodontic treatments on the lower limbs and vice versa. Let me show the small case after treatment of lingual system. It's a 7 years observation without fixed, without fixed appliance. As it was treatment without any fixed appliance, without brackets. It's will be later is another case. And this is 7 years observation. No, when he came to my office, he had any complaints, was referred from other dentists to check the bite. You can check he has a mouth breathing, but he closed his lips. But anyway, it's a very short lips here, and they you can see the blue sorry blue under the eyes, and swallow dysfunction, temporary bone rotation. So look at his bite. It's a deep bite, narrow of the jaws, left milk canine was early extracted, and midline shift. So of course, if the left milk canine was early extracted, the another incisors moves to their place. And we can see no enough space from permanent canine. And 1.5 treatment time. It was just removable appliance and osteopathic support and a lot of exercises. And the boy was very effective in this case. And after 1.5 years later, you can see the treatment results without any fixed appliance, without brackets, without aligners, without very hard technician appliances. So this is before, and you can see after. So very good result. And plus 6 months of treatment and 1.5 years observation. You can see still a very nice result. But a little bit later, and I realized when he came visit us for checkup, and I realized that he has a shoulder deviation and a head deviation. So, and I start to ask him what he do, and I knew that moment that he's a football gamer. Of course, you can see is it not so good sport for good posture, so because they use the homolateral pattern when they play the football. And so I recommend them to do the osteopathic support and other things, the myofunctional therapy again, but he told me, no, I am fine. I told him that later you will be back. And 2 years, 9 months later, without any treatment, he visited my office again and told that he has a painful of his knee and back. The violation of posture, the right shoulder is higher, the pseudo-hollow left foot, and imbalance of 7 kilograms on the right side. So asymmetry inclination of the upper buccal teeth, right and the left, and the right shoulder is higher, and you can see the pseudo-hollow left foot. So in anamnesis, he chewing on the left side, and he has emotional disorders. And we start to retrain muscles again for chewing by overlays. We use just 3 overlays and individual insoles and do a lot of osteopathy support. So after 5 months, posture balance was improved from 7 kilograms to 50 grams. And the positive dynamic of change in the feet profile. So normalization of inclination of the buccal teeth and incisors, it is very, very good result for us just using the 3 pads and exercises and examination of the osteopathic. So if we totally look at the 7 years observation of this boy, we can see the normalization of posture, his mental disorders, and the harsh reality of sport is that in order to achieve any results, you need to satisfy yourself and your body regularly. So, as Conan Doyle said one day, the most serious conclusions are sometimes based on mere trifles. So let's see our discovery. This is case descending correlation structural effect of orthodontic treatment of the TMG and low limbs. So this guy was professional athlete, he was running, and this is the result after his 3 years orthodontic treatment. This looks quite good. And after 3 years, already after retention, he came to my office. It wasn't my patient. He just came visit my office just to ask to check him because he can't run properly now, and we can try to use the video. If you check the video, you can see his hand in the foot, the right foot stepped not correctly. So it happened after 3 years of orthodontic treatment. And look at his teeth and uneven upper jaw, then rotation of premaxillary parts of maxillar, and look at this. Our discovery was dependence of the tipping of the premolars and the position of the Achilles tendons is exactly the same. And in this case, this patient can have the TMG disorders. You can see the click if we check the, I don't know, can you see the click? Can you listen the click? So mandible deviation to the right and another thing. So, and this December, in our journal, the Orthodontics, it's Russian journals, we have articles where we have a conclusion according to results of the study. It can be concluded that it's most patients, there is a correlation between the angle of inclination between the upper first premolar and the angle of the homolateral side and heterolateral side, and totally is about 100% of our patient. And this is another study about pain of the palpation lateral pterygoid, and it's really have a correlation between posture And based on result of this study, subject with unilateral disc displacement showed the postural deviation in the pelvis, lumbar spine, thoracal spine, head and mandible, therefore suggesting a cross relationship between body posture and TMG. So this is another ascending case, ascending type of case, correlation structural effect of the lower limb and result of orthodontic treatment. You can see the guy who grew up very quickly, and this is 3 years after orthodontic treatment, and you can check ascending type of the postural disorders and curve of his leg, very horrible. And the right side of the upper dentition is narrower, more vestibular inclination of the buccal teeth on the left. So a more palatal inclination of the premolars on the right. So, and look at the his Achilles tendons and profile of the feet is the flat feet and valgus, and the different inclination of the Achilles tendons. And exactly the same. But do you know why we have a valgus? Valgus is a weakness of the muscles tibialis posterior. So it's part of anatomical train, as you can see on this picture. So, and this is our other research in the same is December, and influence of occlusal disorders of the development of scoliosis. So our CBP concept, cranial postural concept, the asymmetrical narrowing of maxillar, asymmetrical torque of the posterior feet, it can be reason for the displacement of mandible towards the graded width of the upper jaw, asymmetrical chewing, psychosomatic disorders, formation of pathological contact of the teeth, and development of the TMG dysfunction, asymmetrical roles of muscles of the head and neck, impaired vision, hearing, swallowing, and speech. So, postural violation, the development of idiopathic S-shaped scoliosis of the descending type, dysfunction of the organs of the thoracal abdominal region. So it's a reason for rotation of the pelvis, dysfunction of the organs in the pelvis region, more is formation of the flat valgus pathology of the feet, dysfunction of structural organs of the region of the lower extremities of the feet. So the result of, for example, the rapid palatal expansion. This guy was referred to me by orthodontist after rapid palatal expansion. And of course, the lower jaw couldn't find the right position. And finally, he started to use for chewing the one side. And finally, we can see the huge S-shaped scoliosis. And orthodontic treatment of children and teenagers with asymmetrical narrowing of the upper jaw can lead to the formation of the osteopathic lesion, dysfunction of the spheno-occipital symphysis, lateral strain, as well as asymmetrical dysfunction of the palatine, sphenoid, ethmoid, zygomatic, temporal, and occipital bones. So can you imagine how many bones can be under dysfunction? These reduce the effectiveness of orthodontic treatment and lead to relapse of the decrease, including the development of several clinical manifestation: S-shaped scoliosis, impaired foot biomechanics, pelvis rotation, TMG dysfunction, etc., etc. We use CBCT of the head, electromyography, podoscope, Deers formatic diagnostic complex, photo face, teeth, and posture. We do a lot of objectification methods for these children. And look, this is comparison of clinical disorders in the main group and control group. And these guys that you already seen can be treated not only with orthodontics, with osteopath, and kinesiotapes help to get finally the better posture. And the displacement of mandible to the right and left before and after is much better in the main group with the osteopathic support, airways before and after, swallowing, strabismus before and after, including the latent strabismus. Main group control was completely much better in the final result. And you can see electromyography before and the group with the osteopathy support, temporal masticatory and temporary muscles properly indicated. So, and you can see the strabismus before and after treatment on the left side after 4 months of treatment, and the analysis of the result of the study of the frequency, the occurrence, the profile of the supporting foot on the podoscope in patient of the main group had positive changes in terms of identify the combination of profiles of the supporting foot between the right and the left foot, and load distribution in the 93% cases. Similarly, no disorders were observed in patients of the control group, since the main manifestation was detected in only about 7% of cases. This proves that the pronounced effect of the descending dysfunction on the posture and supporting profile of the feet association with the malocclusion in these 2 groups of patients. So it was our research. Finally, conclusion: the asymmetric narrowing of the maxilla is closely associated with the cranial posture dysfunction, disturbance of the static dynamic balance of the body, dysfunction of the main patterns of the chewing, swallowing, breathing, stepping. Treatment of asymmetrical narrowing of the maxilla should be both orthodontist and osteopathic examination to achieve a more predictable result without complication. So, and let's show the clinical case. We call it the sport of the highest achievement lost of the athlete. This looks quite good. This is a girl, 15 years old. It really looks quite good, but if we look more attentively, we can find a lot of problem in this case. She was a rising start of rhythmic gymnastic, and when she was 8 years old, she was a diagnosis as S-shaped scoliosis, very hard quality of that. Bite pathology and the dental and development of idiopathic S-shaped scoliosis are often associated with asymmetrical bite pathology. Development or rotation of the maxillary mandible, missing of under-eruption lateral teeth, malposition of the tongue rotation or lateral displacement, impaired swallowing, chewing, and breathing patterns, asymmetrical function of the muscles and ligaments of the muscle facial region and the neck. So this can be caused by reduced oral cavity volume and narrowing of rotation of the upper jaw, mouth breathing, desert of everything, congenial torticles, and more. So let's look her S-shaped idiotic scoliosis grade 4. At the age 8, she was diagnosed with S-shaped scoliosis, and when she came to me, her complaints were due to increase in scoliotic deformity during 7 years of using the Chenot corset. 7 years she used the Chenot brace. So a look at her head rotation, the problem with the feet, the problem with the position of the leg, and flat valgus on the right side, mouth breathing. Of course, you can see it. And we can see the rotation of the upper and lower jaws, and hypertonicity of the masticatory and temporal muscles on the right, and clockwise rotation of the jaws, and smile asymmetry, rotation and shift of the cervical region, displacement of the axis of the condylus of the TMG, asymmetrical of the width of the upper jaw and its transversal rotation curvature of the spine is exactly the same as palatal suture. Of course, in this case, angle class 2 on the right, class 1 on the left, midline shift, and this is the skeletal problem. And I have a patent for the cranial postural balance appliance for treatment of odontogenic S-shaped scoliosis. We start to call it odontogenic scoliosis because we're sure that if the reason for ascending descending disorders, type of disorders, if it's reason the bite, so we shouldn't call idiopathic scoliosis. We have to say this is the odontogenic scoliosis because the first reason is the bite. And the use of various removable double jaws appliance for orthodontic treatment is largely limited the maxillofacial area without regard to sending analysis of short leg, pelvis rotation, or internal organs disease, or descending cranial deformity, bite pathology of dysfunction of the temporal mandibular joint and neck region, etiology of bite pathology. This approach doesn't allow for correct of the posterior general musculoskeletal system and feet. And I provide this, I would like to introduce this appliance. It's a very simple appliance, but if we check our patent, you can see all the details, and this is the special inclination of the wave bar in the palatal bar, in all details in the patent. So I developed an application of various functional appliance that allows for the comprehensive analysis of treatment of both musculofacial anomalies and postural muscles balance disorders is relevant. So I developed these appliance in the J4, jaw functional orthopedic paradigm. The main purpose of the device is to improve the function without actively affecting the teeth and indirectly influences on posture. So in particular, affects three S-shaped scoliosis with a downward etiology and development. So no pushing forces on the periodontal ligament of the teeth, no fixing claps, only the vertical protection, and using swallowing for the treatment and the remodeling the alveolar bone of the maxilla and manual through the proprioception of the soft tissue and bone. So the result of this patient, after 7 months, you can see it was just 27 millimeters between first premolars on the upper. After 7 months is 30.3 millimeters without any activate of this appliance. 7 months later, we can see the degradation of the jaw bones itself using just this appliance and osteopathic support and development of the upper jaw, formation of symmetry of the dentition and wider. So, and this is the normalization of the open bite of this using this appliance during the 7 months. And we correct the class 2. And as you see, we have and a little bit hypercorrection of the on the right side. And when we check and use the Deers for metric motion for check this patient, this is the beamless and contactless method, quick examination procedure. So we can see the pelvis rotation was 4 millimeters before and after with this appliance, it was a 0. It's a very, very straight pelvis. And vertical deviation was 24 millimeters before and 19 after. And this is how we improve the posture, especially in the lumbar or cervical region, elimination of the costal lump. This is the Adam test. This picture sent me from the orthopedist who made the Shino corset for her. He was very excited that suddenly after 7 years and something happened. And was very surprised when she told that she started to use the orthodontic appliance to correct the scoliosis. So this is 7 months later, the verticalization of the spine is noted, and you can see the difference between the spine and the feet. Feet is more symmetrical now, is much better, and formation of the rolling soft of the right it's very important for the step. So, and you can see, and this is the examination positive dynamic after 7 months. And after 11 months, we can check the position of the condylus of the TMG condylus and position on the neck is incredible result. And as you remember, it was the pelvis rotation 0 and deviation 19. And after 11 months, we start to use, we start to make a little bit the simple appliance, the new one, and check the bite registration for this appliance using this device. And we can see without bite registrations 11 months later, the pelvis still was the 0, it was straight, and vertical deviation was 12. And with the bite registration, vertical deviation was 3. So we start from 24, and now the vertical deviation was 3. It's incredible. So if we have examination on the podoscope with positive dynamic and a very nice picture for her feet, but unfortunately it's not perfect, but really nice improvement. And 11 months later, we can see how improvement her face and electromyography is much better. And this sphenoid bone rotation. And this is the DIRS. This is the scoliosis angle. Is the same as Cobb angle, and from 45 degrees to 33 degrees is very incredible result. And 11 months complex treatment, symmetrical smile has improved. We can see the rotation of maxillar, symmetry of smile, and indication of the lateral teeth of the upper jaw is more symmetrically. So we compare podoscope examination before and after, and we do a lot of things during this 11 months. Expansion of the upper jaw without any forces of the teeth, formation of symmetry of the upper dentition without activate our appliance without any forces of the teeth. Again, symmetry of the smile, inclination of the lateral teeth of the upper jaw, the rotation of the cervical region, and centration of the condylus of the TMG, improvement of the lumbal cervical region, elimination of the rim, hump, symmetry of the teeth, symmetry of the position of the lower jaw, and the tone of the masticatory muscles, a slight rotation of the treble preserved. So unfortunately, I don't have time to show the huge case, and just would like to say you the very important things that the good teeth has a good skull, and the good skull is a good body. And this is home message for you. The TMG disorders and expressed malocclusion with which the patient refers to an orthodontist, a recurrent mandatory consultation of foot and posture specialist to find the flat feet, valgus feet, odontogenic scoliosis, emotional stresses, and other disorders of the musculoskeletal system. Use the tongue as the best lingual appliance. Interdisciplinary approach is the deposit of stable result of orthodontic treatment. And for our examination for our patients, we do, in my dental religion, we check a lot of things. We try to find all traumas, scars, and do have a lot of information. And first, we check the postural balance assessment, head position, shoulder levels, patient posture. We do a lot of manual muscles examination, descending, ascending types of postural dysfunction, present of general somatic decreased habits, using cranial postural balance algorithm for planning and treatment. And the final step, I would like just show you the video. This girl couldn't, this is, she is gymnastics, and she couldn't do this type of exercise. And when we did our protocol during about the 30 minutes and fix appliance to her mouth, and after that we ask her to do it again, and you can see it's quite nice, and you can check her how was surprised for her that finally she could do this. So in my conclusion, my dental religion, the cranial postural balance, malocclusion and TMG disorder often arise as a result of attempt to adapt a cranial deformation, dysfunction, or vital patterns, poor posture, musculoskeletal problems, injuries, decrease of internal organs, deformities of the feet and toes, and emotional stresses. Conversely, malocclusion can lead to all of the above general head problem. So a comprehensive approach and more details overall assessment of the patient, required preliminary preparation of the patient before dental in version of the necessary so as not to lose compensation and not to worsen the patient health. So, and thank you so much. Thank you, Marian, that you invite me to have my presentation and share my experience and my dental religion. So thank you everybody for your attention, and please you can write me what all your questions, and of course I can answer for your questions as much as as soon as I can. Thank you.